Hello and welcome back to the Anti-Aging Hacks podcast. Today, my guest is Dr. Jason Champagne, who's a board-certified facial plastic surgeon. He's Hollywood's in-demand facial plastic surgeon. He is the behind-the-headline making eyebrows of stars like Chrissy Teigen and Megan Good. Dr. Champagne is also sought after by A-list celebrities for his customized and artful approach to jaw surgeries, chin implants, forehead reduction, hairline lowering, and rhinoplasty. He's one of the only surgeons in the world who utilizes 3D CT scans of the face in order to create a fully customized and individualized implant for great transformations and natural looking results. Another of his treatments is the Champagne HairlineRefine, which is the forehead reduction and hairline lowering procedure, which provides a custom tailored experience in hairline modification and expert refining and advancing the hairline. With that said, Dr. Champagne, welcome to the Anti-Aging Hack Show. Would you like to get thicker, fuller, and stronger hair? Then make sure to check out fullyvital.com. The team's come up with fantastic and natural products that help rejuvenate your hair, but also delay and reverse gray hairs. So if you're interested in better hair, go to fullyvital.com and use the code ANTIAGINGHACKS for 15% off your order. Are you enjoying the shows on this channel? Then please make sure to hit the subscribe button down below, so you can get notified when we release new episodes. Our goal with this show is to help you and give you practical tips that you can use to slow down and reverse your aging so you can live and feel younger and live your best life. With that said, let's get on with the show.
Hi, thank you for having me.
So let's get started. Tell me about how you got into having an office and doing facial plastic reconstruction and surgery.
So I always sort of knew that I wanted to be on the West Coast. Beverly Hills is, to me, the mecca for facial plastic surgery or plastic surgery in general. I started my life in medicine in residency training in head and neck surgery. And part of that training is facial plastics. So I chose that route specifically because of the facial plastics experience. Um, Facial plastic surgery is both cosmetic and reconstructive. I lean more towards the cosmetic side. It's creative, it allows me to um, use my creativity and artistic touch to make something that is completely normal, just a little more enhanced, or taking it from an aged look to a more youthful look. Um, and Beverly Hills for me was the place that people they look to Beverly Hills for the latest and greatest and the best technology, and the best of the best surgeons are located here. So it's basically why I chose Beverly Hills as my home.
Is there a risk of having too many surgeons or facial plastic reconstruction folks in Beverly Hills?
Um, to be honest, I think you have to stay on top of your game to be the best here, and to be able to continue to have a successful practice. I'm sure there are many surgeons that come to Beverly Hills and maybe move out after a certain time. That's possible. But I think that the more the merrier, because it allows us to be the best of the best. It keeps that competition going overall. And I think that's important. You want to stay on top of your game to be able to provide that service to patients.
Okay. So you've got this practice in Beverly Hills. Tell us about what are the most common procedures that people come to you for.
For me, I am a facial plastic surgeon. I perform cosmetic surgery on only the scalp, face, and neck, nothing below the neck. Um, I also have a specialty in hair restoration. So I specialize in hair restoration. I perform hair restoration on the scalp, mostly for men. Um, Many of my patients are females, and they come to me for eyebrow hair transplantation. And in addition to that, I also perform hair transplantation for the beard and mustache. Um, One of my most popular procedures. The majority of my week is spent consulting and performing eyebrow hair restoration. And that procedure, I call it champagne brows. So that is probably number one for me. My second most popular procedure is my customized mandibular implants, and including full mandibular, that's jaw angles, body of the mandible, and chin implants to improve symmetry, also to improve width and projection of the chin, width of the jaw angle. So that's my probably number two most popular procedure.
Got it. That'll be a fun conversation to have on a different podcast. Right,
Absolutely.
right now, I think we want to talk about hair. And so, yeah, I would love to talk about hair on the scalp, hair on the eyebrows, hair on the beard as well. So let's start with the scalp. Who's uh who's coming? I would assume mostly men are coming to you for restoration of hair on the scalp. And what are you seeing? What age ranges are these men, and how long have they been experiencing hair loss before they even come to you?
So, I've practiced in residency on the East Coast. On the West Coast here, especially in Beverly Hills, I see younger patients who are starting to see hair loss but haven't let it go very far. And I think that just has to do with awareness nowadays compared to the past, but also patients here seem to want to stay on top of things a lot earlier, get on top of it a lot earlier than patients in other parts of the country where they kind of let it go and then maybe they decide to do something about it. Um, for the scalp, yes, men are the larger part of the population of for hair loss. Male pattern balding is pretty common. About 50% of the population experiences male pattern balding, the male population. However, women also experience hair loss on the scalp. Um, but for me, most of my patients for the scalp are men. We treat those patients both non-surgically and surgically, and to me, that's the best way to look at this. Hair restoration in general, as a surgical procedure, is good to regain hair. However, it doesn't prevent further hair loss. So when I
Mhm.
see my patients, I also consult with them about preventing further hair loss, and that's very, very important. Um, Younger patients come to me in their, I would say, I've seen some patients as young as 18, 19 years old. Um, it depends on how rapid their hair loss is happening. And that sort of sways me in one direction or the other is how we're going to approach this, how we're going to treat your hair loss. Let's say I have an 18-year-old guy who comes to me and he's already lost hair and started noticing hair loss since he was 16 years old. His dad's completely bald. His grandfather's completely bald. He's very likely to end up in that same position. And so if he's already losing a lot of hair at 18, we have to try to do whatever we can to prevent further hair loss before we even consider any type of hair restoration procedure. The reason is because the more hair that we can keep, native hair, the better outcome he's going to have for the rest over the rest of his life. If we just let his hair fall out and then try to transplant and replace that hair loss, we really don't have enough donor hair to regain that same density that he could have had if he had prevented hair loss, if that makes any sense.
Mhm.
Hair restoration relies on typically hair from right above the ears and in the back of the scalp called the occiput. This area right in the region, there's a little ridge of bone there where your skull meets your neck, somewhere in that region. And if you think about it, that's the area where men who you've seen completely bald, they still have that sort of little horseshoe shape of hair left here. And that donor hair is usually good quality. However, if you think about it, that's not that much hair there compared to how much hair you can lose on top.
Right.
And so we have to really think about where our patients are headed, where my patients are headed in order to treat them properly so that we're doing the right thing for them.
Mhm.
Older gentlemen, let's say they're in their 40s and they're experiencing progressive hair loss, but a very slow time frame, 15 to 20 years of hair loss where their frontal hairline is just receded some, maybe a little hair loss in the crown, but in general, the central vertex here, they still have a lot of hair. Those patients are on a different path than that 18-year-old. And so it's still important to prevent further hair loss, but there's a little more room to work with donor hair and restoring that hairline versus that guy who's 18 and is likely to lose everything if we don't get on it quickly. So
Mhm.
that's how I sort of approach every patient. It's an individualized basis. What's your story? Tell me your history. How fast are you losing hair? What's your family history look like? And then we can come up with a game plan, treatment plan specifically for that patient.
Yeah. I bet the patients that are losing hair very, very slowly over 15 or 20 years are the best because you're like, cool, I can really top you up and you're going to be good for the next 20 years, as opposed to the kid that's 18, 20, that's aggressively losing hair. And not only do you have to maybe transplant some back, but you have to hold them so he doesn't lose even more. I've heard stories about people doing 2 or 3 transplants in the front and then losing all their donor hair. It's gone. And now the hair loss is still progressing, which means now you have an island of hair at the front, no hair in the middle, and your crown is bald too. And so you have to basically laser off the new hairs because you just look so weird. And that's just a nightmare scenario for anybody to be in because you've spent so much money. And so when it comes to, so this is the $100 million question of why some of the hair on the back of your head are not susceptible to the hormones that are ravaging the front of your hair, the side, even some for some folks, a little bit of the sides. Why does this happen? Do we know answers or still up in the air?
I think in my mind, I don't know that there's an exact answer. In my mind, it has to do with genetics and receptor susceptibility, numbers of receptors for DHT, which is dihydrotestosterone. That's a, not to get too scientific on you and on your listeners, but that is a breakdown product of testosterone. So guys, especially, we all have testosterone floating around in our bodies, and there's an enzyme. It's alpha reductase, 5 alpha reductase that breaks testosterone, it reduces testosterone into dihydrotestosterone. The DHT is at least 5 times more potent and able to attach to receptors, androgen receptors on our hair follicles, basically. So in my mind, it has to do with the susceptibility of the receptors on that hair versus the top of the head, and then potentially the numbers of receptors on those hair follicles versus on the top of the head. Um, and then some patients, for whatever reason, are more susceptible to DHT than others. It just and that has a lot to do with genetics. Um, and so, in general, just looking at hair loss patterns, we sort of know that that area for most guys is going to be good donor hair. Even if they're in an earlier stage of hair loss and we don't really know where they're headed, we at least know that that area is most likely to be permanent when we transplant it because it should never fall out over the course of their lifetime.
Mhm.
Some patients, however, are really not good candidates for hair restoration because in addition to losing hair here, they also start to thin out in that donor area.
Wow.
Some of these guys I've seen, their hairline at their neck is starting to ride up high and starting to thin out, and then their crown is starting to dip low, and they have this little area, but even that donor area is very thin. And so it's a tough conversation with some of these patients. The younger guys who are on this path of likely near, complete hair loss on the top and sides with a very small strip of hair left. And then these other guys who really just don't have good hair quality.
Mhm.
And that hair transplantation is not likely to be very successful. And if it is, many of those hairs may shed over time as well because they were destined to shed in the back of the scalp over
Mhm.
time. Um, so some of the conversations I have with my patients are very difficult because
Yeah.
a lot of guys are looking online and they're looking at all these treatments and like, oh, I would definitely want to have a hair transplant. And then they come to see me and we talk about their history and I have to, tell them, unfortunately, you're really not a great candidate. And that's a hard conversation.
Yeah.
I totally understand putting myself in that patient's shoes. It's like, and so hopefully in the future,
Yeah.
research, we have some better answers. Cloning hair, figuring out how to modify the genes, maybe, for hair loss.
Yeah.
That would sort of be the direction that hair restoration, in my mind, is going and should
Mhm.
go, to where we can really be preventative of hair loss in the future.
Yeah, I love that. We have the technology to cut out some parts of the genome, but we just don't know which genes are impacting hair loss. And it's too risky to do it at the moment because we're still very early days. But I'd love to see this progress further, as you said. Let me touch on women's hair loss briefly, because From what I understand, male hair loss is primarily because of DHT. It's most aggressive in its early days, meaning right after puberty, 18 to 25 years, maybe. It gets slower as men get older because testosterone levels are going down over time in their 40s, 50s. And so you would assume the DHT levels are going down as well. So it won't be as aggressive later on. But for women, it seems to be the opposite because estrogen is very protective for them in their 20s and 30s. But then as they hit perimenopause and menopause, 40s, 50s, they seem to have more hair thinning, which is hormonal because they see their part on the top of their scalp is widening. Of course, there's other reasons for hair loss in women. It's multifactorial. But what's been your experience in dealing with female patients, which I know is not the majority for practice, but what are your thoughts there?
Yeah, I mean, you're right on point. That's all true. Women, perimenopausal, postmenopausal, see more hair loss at that point because of the hormone changes. Um, Treatment wise, it's for me, we have to attack that type of hair loss more sort of aggressively from all different modalities. Vitamin replacement, hormone, blood draws, which I don't do. I send them to either the primary care or an endocrinologist or someone who will do the blood work and sort of work with those, their hormone levels. That's something that's outside of the scope of my practice. Um, but I treat with laser cap therapy, specifically one that's dialed in right around the 680 nanometer range. That's usually the best wavelength for hair replace or hair regeneration, hair follicle regeneration.
Mhm.
Improves blood flow, dilates blood vessels, stimulates angiogenesis, which is new vascular or blood vessel growth into the scalp. Um, so improving blood flow, providing the nutrients and minerals, vitamins that we need, that should all help. In addition to postmenopausal women, we can sort of venture into using finasteride for those patients because they're outside of the childbearing years and less risk there. However, I still sort of leave that up to their primary care or endocrinologist kind of to treat those things because it's again outside of my scope. As a hair restoration surgeon, I'm a surgeon primarily, so
Mhm.
to some degree, I'll prescribe finasteride, either oral or topical, to my male patients. When it comes to women, it's a little bit different. So I prefer them to be treated their OB, GYN or an endocrinologist or their primary care when it comes to that sort of thing. But we can work in tandem as far as that goes. And then, in addition to those things, I also perform injections of what's called exosomes. You may be aware of this. Exosomes are little microvesicles, messenger molecules, if you will. They're smaller than cells. They don't contain DNA, but they go between cells and basically tell cells what to do. It's sort of their job. Exosomes, specifically for hair loss, help to rejuvenate the hair follicle by reverting the hair follicle from there's three different phases of hair growth and loss: anagen, catagen, and telogen. Anagen is the growth phase, the telogen phase is sort of the shedding phase. So they can help the telogen phase revert back into the anagen phase and grow a healthier follicle. And that's sort of our cycle. With hair loss, a lot of those hair follicles can't get out of the telogen phase. The DHT attacking the follicle doesn't allow it to go back into the anagen phase. Basically, that's just the gist of it. And so exosome injection therapy can help transfer that follicle from a telogen phase back into a growth phase, allowing for thicker hair. Now, if you don't have a follicle, we can't get a follicle to grow in that place. That's where transplantation comes into play, where we're actually replacing lost follicles, follicles that have died and they're long gone. So now we're putting a follicle back in that spot to grow new hair in those places. So for me, women, uh, it's multifocal. We have to attack it from all these different angles in order to improve density of hair. I've also found that with women, it's a tough conversation because women want that full head of hair. They want hair, the way they had it in their teens and 20s. They want it back. And I understand that. Hair is everything. especially for women. For men too, however, men knowing that male pattern baldness exists and a lot of guys have it, and their expectations overall are a little lower. They're like, yeah,
Yeah.
I'm losing hair. If I can get some hair back, great. But their expectations, when I tell them, well, we won't be able to get a full head of hair back for you, they kind of accept that overall. Whereas women are like, oh, well, I don't know if I even want to do it if I can't get a full head of hair. So
Right.
it's that sort of thing that comes up, and it's true. And those are tough conversations as well. So
Hmm.
it's just something that I have to keep in mind when I'm talking with my patients. Everybody's expectation levels are different. Male versus female, the expectation levels are different. So.
Totally. Okay. Let me follow up on exosomes. For the longest time, PRP seemed to be what dermatologists were using as the gold standard for restoring thickness and volume of hair. And then at some point they were adding on additional items to the PRP like A-cell or others, extracellular matrices. And then there was some push towards doing stem cells for hair, which I don't believe went anywhere. And so now I think the exosomes is the new thing, the new kid in town, new kid on the block, and seemingly doing better than PRP.
Mhm.
Is that fair from a result standpoint? Do you see exosomes doing better than PRP? So let's just answer that first, please.
Yes, no, I do. I do.
Okay.
And as a matter of fact, I've had my own scalp injected with exosomes.
Hmm.
I used PRP for many, many years. I've now transitioned my patients over to exosomes for the majority of my patients who are coming in. I'm recommending exosomes just because I have seen exosomes work so much better than
Hmm.
PRP.
Hmm.
In my mind, PRP was sort of hit or miss. I couldn't
Yeah.
I couldn't really tell patients whether or not they were going to respond, but it was a reasonable treatment. Um, I had some patients respond amazingly, and then had other patients not see anything at all. And so it was hard for me to say, yeah, I can offer you this treatment. It may not do anything. You may
Hmm.
spend a couple $1,000s and it not do anything. And that was a hard sell, for some patients. Other patients are like, I'll do anything, even if it doesn't work. I want to try it. So,
Right.
it depends the patient's threshold for tolerance. But um, when it comes to exosomes, I mean, the the response rate for my patients is high 90th percentile. I mean, it's
Wow.
it's up there where and you can I've spoken with other hair restoration surgeons. I've been in on conversations with other dermatologists and all these physicians who are treating hair loss with exosomes. And the story is the same, where we're in the high 90th percentile, where we can tell patients, you're likely to respond. How much you're going to respond is still unknown overall, but you're going to respond.
Hmm.
Uh, I've seen some patients who have this little tiny patch of hair left in the middle, and that tuft just grows, and at least they have thicker hair in that tuft. It's
Yeah.
not, again, not going to grow hair back where you don't have a follicle. So patients who, in my mind, the guys who I've seen, and you may be, you aware of this too, that have that generalized thinning all across the top, but still have hair there. It's just the fine, wispy kind of hair. That patient, to me, is the best candidate for exosome therapy
Hmm.
because he doesn't have a lot of hair loss. It's just thinned so much, meaning that the shaft size of the hair is so small that it's easier to see through and you're starting to see the scalp, but the hair follicle is still alive. It's
Hmm.
just beaten to death, almost by DHT.
Yeah.
And so if we can reverse all of those fine hairs back into anagen and get thicker hair and save those follicles, that's the best candidate for exosome therapy in my mind.
Yeah.
Other guys I treat, let's say those patients that I was talking about earlier, that they're also thinning in the donor area. If they come in, I'll say, let's try exosomes first. Let's inject not just the top where you may have some hair loss, but also the back to improve the quality of the donor hair. And then once we improve the quality of the donor hair, then we can consider surgery to place those healthier hairs on the top of your scalp.
Hmm.
Um, and then maintenance of exosome therapy, maybe every 3 to 4 years or so, injection wise, versus PRP, which was one every 3 months in my practice for the
Yeah.
first round, and then about every 6 months maintenance.
Yeah.
If you saw a decent result, and you would stay on that regimen. Um, for exosomes, it's a lot longer time frame as from one treatment to the other. And so I think that's also really good, and it's a little more expensive up front versus PRP, but over time, if you do all the PRP treatments, it's going to add up and surpass
Yeah.
exosome therapy.
Got
So
it. This
exosomes in
is
my mind are excellent. They're great.
Yeah, this is really good to hear because I'd heard some of this data as well a couple of years ago, and I wasn't sure because I wanted to see what the follow-ups look like, right? So they haven't, let's say you do an exosome treatment, the patient's gone away for a year. You don't actually know what the hair is like until they come back, and you
Mhm.
say, okay, here's your picture before, here's after. It's still holding. It's been a year, 6 months, 2 years, and so you're saying it can hold for 3 or 4 years, which is insanely good compared to what PRP was offering us.
Right. And well, and this is just for my own practice,
Yeah.
it's I've seen this in my practice. I started using exosomes in late 2020.
Hmm.
Um, and that's around the time frame when I had my own scalp injected, and I followed my along with myself photos and that sort. I would say exosomes alone are good, or is it's a good treatment. However, I don't just say, you should only do exosomes. I also include other regimens. So
Sure.
topical or oral finasteride, minoxidil, laser cap therapy. So, we're still treating it from, different angles, and improving blood flow, reducing the DHT, stimulating telogen back into anagen phase. So there's multiple ways of attacking it, but exosomes alone in studies have shown, significant improvement in hair density and
Mhm.
longevity over time.
Wonderful. So the follow-up question I would have for you is that the last time I spoke to somebody that was doing exosomes, I believe it was a 5 ml injection, 5 milliliters of injection into the scalp that covered the whole scalp, and they were good for, like you said, a few years. But the question then comes that there's many companies that are selling exosomes and touting them as they're the best one, right? Add to that, there's people probably listening to it that are overseas. There's different exosome companies there. So similar to PRP, where you had different machines and different ways of spinning the PRP and centrifuges, is there any variety in the different types of exosomes and who's providing them? And should people expect different results based on those?
Yes, there are different companies. I can't promote any specific company,
Yeah.
but there are specific companies that have exosomes for hair loss,
Mm.
for skin rejuvenation. You shouldn't be injecting the exosomes that are for skin rejuvenation into the scalp for hair loss. Um, there are companies that are selling exosomes that are likely not as effective. Specifically, the ones that I use are harvested from mesenchymal stem cells around the matrix around mesenchymal stem cells.
Mhm.
Um, but you're right. There's a range of types of exosomes and different companies that sell them. And potency is different. So, we have to be careful, do our research as a physician as to which ones are best and what's going to help our patients. Um, so that's you're right when you mention that, as something. I think it has to be the patients have to have trust in their doctor that they're using the right exosomes
Mhm.
to some degree, because it's sort of outside of the scope of a patient's knowledge base as to which doctor is using the right exosomes,
Right,
basically.
right.
So
It's
you have
very
to
hard
kind of,
to know. Even if you
yeah,
call
it's
the
very hard
doctor,
to,
he's not going to really tell you what company is providing the exosomes. That's
yeah.
their information. Okay, so I guess you've mentioned this item a couple times, meaning the follicle being alive or not. And I've heard different people say different things, saying some people say we can go back 10 years in time after you lost the follicle, after last hair grew at that spot. Some people say it's more like 5 years, some people say it's 3 years. What has been your experience and how far back you can go on hair that is seemingly lost?
In my mind, unless you have a biopsy of the scalp, take a biopsy and you can see uh, basically a, a tiny hair follicle present with no hair. coming out of that follicle, and then somehow, you could study and reverse that hair follicle back into the growth phase. That's really how you can maybe tell how that follicle is going to respond, or if it's still present. Visualizing the scalp, looking for basically little tiny hair tufts that are still present, then you can say, okay, there's a little hair follicle there. Um, to me, I think 10 years is a very long time. There's still studies that show that there's tiny little residual hair follicles present that could be reversed back into the growth phase after many, many, many years. To put an exact time frame on it, I don't think 10, honestly don't think 10 years, that's too far out, but maybe
Mhm.
within the past 5 years that there may be still a residual follicle present that could regrow. Injecting exosomes over the last 4 years or so, I've been surprised by some of the gain that we get in the temples and the frontotemporal peaks, these areas here. I've seen some hair growth just looking at photos and comparing distances from landmarks like little, blemishes on the forehead, a little tiny mole or so on the forehead, and just taking photos, regaining a quarter to a half of a centimeter of a hairline that to my eyes didn't look like there was any hair or follicle present, any tiny hair left there, but we regained growth from that area. So, I think that there is hope when it comes maybe within 5 years of hair loss or so.
Mhm.
10, it seems
Got it.
like that's a bit far out.
Okay, so
Yeah.
as much as possible, you want to do everything you can to keep the hair follicle alive within recent memory, right? So if it's gone too far, then you're maybe just out of luck at that point.
Yeah.
And so, okay, so let's get to the actual treatment or the actual procedure. There's two types of hair loss procedures, from what I understand. There's the FUE, which is the newer one, and then the FUT, which is where you just slice off a piece of the scalp in the back, and then you are able to extract the hair follicles from there. Which one do you do, and what are the benefits of either or?
I perform both, honestly. Some patients are better candidates for one versus the other. So I have an in-depth conversation with them. Also asking lifestyle. Do you ever shave your hair to the skin? Do you ever plan to in the future? What do you do for a living? I have a lot of actors who may take on roles where they have to shave their scalp and they don't ever want to have that linear incision in the back. Different surgeons have different results when it comes to invisibility of incision lines in the scalp. Some scars can be really wide, some are very thin. Technique has a big role in that. However, some patients' skin itself is very stretchy, and when it heals, it tends to, create a little wider scar. So it's predictable in most patients, but a little unpredictable in other certain patients. So those kinds of patients really choose the FUE method, which is the method where we individually punch hair follicles out from the back of the scalp, the donor area, not leaving any linear incision line. So you may have tiny little punch scars, but they're very hard to see, especially nowadays. Our punches are so small, just big enough to punch out the hair follicle and not remove any excess tissue from around, that it's very hard to tell that anything was ever done, even if the scalp is shaved, the hair is shaved to the scalp. Um, so the FUE method is good for certain patients who have great donor hair and a large area of donor hair. Um, that method reduces the density of the hair in the back, especially if you do 2 or 3 procedures, because just imagine shaving the back of the head, which is how we have to perform this procedure. We have to shave the hair in the back and then individually punching out follicles from everywhere in that donor area, but sparing hair in the middle so that it hides, right? We don't want to punch out a solid square of follicles and completely remove all of those hair follicles, and now you got a bald spot in the back. So specifically, I choose when I'm performing this procedure, I choose which ones I'm going to harvest. The good thing is I can choose the really strong, dense hair follicles if we need larger follicles, meaning groupings of hair that grows 2, 3, even 4 hairs per follicle group or follicular unit versus individually choosing single hairs that we might use for the hairline as a transition. So that method is really good for those types of patients who don't, number one, don't want a linear incision in the back because they may have to shave their head. It's a little less painful than the actual incision. There's no stitching, no sutures involved in that process. However, even in the best hands, there's potentially a little more trauma to each one of those follicles. There's a chance that you might shave a portion of that follicle off as you're punching that follicle out, and that could potentially not allow that follicle to survive. And so I have hair technicians that I work with, and every punch that I create and we're removing, we actually look at that follicle under the microscope to make sure everything is intact before we transplant it. That being said, you can lose a few follicles that way, right? So your donor yield, if you're, let's say we're doing 1,000 grafts, your donor yield, you may have to, if we're counting them out, we may lose 50 to 100 hairs, follicles before we get that number, that 1,000. So
Mhm.
we've kind of lost a few, even in the best hands.
Mhm.
Um, and so for that reason, you might be causing a little more donor loss than we would like. To me, hair is everything. You want to save every follicle that you possibly can.
Right, right.
So in that case, the FUE yield is a little less if you overall, if you look at it that way.
Got it.
The FUT method, follicular unit transfer or transplantation, is where we make an incision. I make an incision in the back of the scalp, remove a strip of hair, suture that closed. The density of that donor area doesn't change because we're removing a strip, but then closing it on itself. So the hair above and below doesn't change density as compared to the FUE method. But that does leave a linear incision line. So if you're a guy who never plans to shave their head, has, a quarter to half-inch hair length in the back or longer, it should hide very well in that hair and never be noticeable. That method allows for a little better yield because it's very precise. I'm making an incision. I can see the root of the follicle as I'm removing that strip, not damaging any of those follicles. And then under microscopes, my technicians are very carefully removing the excess tissue from around the hair follicles. We can see from the surface of the skin all the way down to the root of the hair, the follicle itself, and just trim away the excess tissue and very cleanly and carefully place those follicles back into the recipient area, knowing that those hairs, looking at them, they're not as traumatized as the follicular unit extraction or FUE method. So yield is a little bit better in that case because we should get a 90 to 95% growth, or maybe a little better than that out of that FUT or strip method. Even though it's the older method, for some patients, it's the better way to go if they have a lot of hair loss and we're trying to preserve as much hair as we can and transplant as much hair as we can and not reduce the density of their donor area in the back overall. That could be the way to go for that patient. So it just depends on the patient themselves. Some guys choose, they're like, after describing the two options, they'll go, no, I want that strip, or no, I
Mhm.
want the FUE. So it
Got it.
just really depends.
How long does the hair transplant procedure take? Is it just one day in the clinic or?
Yeah, so we in my office we can achieve, several thousand follicles in one setting. If we're doing a very large procedure, somewhere around 3,000 to 3,500 grafts, um, or individual follicular units, that can take 7 to 8 hours of procedure, in-office procedure. Um, Smaller procedures, 1,000 grafts or so can be done within about 5 hours. But I use local anesthesia typically, where I'm just injecting lidocaine, little anesthesia into the donor area in the back and the recipient area in the front or wherever we're moving hair. And so patients are completely numb. They don't feel any pain after the initial injections, both methods. And I also use oral sedatives or anti-anxiety medications like Valium, for example, to help patients just relax and sort of sleep through most of the procedure. And just it's a very comfortable procedure for them. I do offer IV sedation for those patients who have severe anxiety, or have an aversion to blood loss or seeing blood or anything like that. And so, or needle phobias. And so I do offer IV sedation, but that's more on the rare side. Most patients choose to just do local anesthesia and a little sedative.
Got it. Okay. So let's say somebody comes in, gets the procedure done. What do they then have to do? I think you talked about we have got to maintain the existing hair. What does that protocol look like? Let's just say for a man who's 25 years old.
Right. Well, 25-year-old, I have a different conversation with than a 45-year-old.
Yeah.
You know, so because if that 25-year-old's coming in for hair loss and it's usually pretty significant at that point, and that's early, you're young overall. I have
Hmm.
to say, well, where do you think you're going to be at 45 in my mind? Where do I think you're going to be? And so prevention is extremely important. So the regimen for me is offering everything. The one in that would be everything available to us. It would be oral or topical, or oral and or topical medications, finasteride, minoxidil, a combination of those. Topical serum, nowadays I'm using finasteride. Depending on their scalp, if they have eczema or they have sensitive skin, we might use a little steroid in that. We might put a retin-A to help with the scalp itself. I'll usually put minoxidil, but I also change the formulas depending on the patient too. Percentages of different medications. So I'm compounding those serums for those patients. Um, so that's one method, medication. Let's just say medication. Then we talk about exosome injection therapy. PRP is still on the list, but I had that discussion with patients as to outcome expectations too.
Yeah.
Laser therapy, so laser caps, helmets, whatever one. There's a couple that I like, that are FDA approved, that I think are the best on the market, that I usually recommend to my patients. But like I said, you're looking for that one that's usually around that, for sure in the 600 to 700 nanometer range, but dialed in somewhere between the 670 to 680 wavelength is the best. That's for blood flow, and stimulating new blood vessel or vasculature to grow into the scalp. Vitamins might be an option, for those patients. Checking your hormone levels. We want to kind of see and follow along where you are, where's your testosterone levels, what are your DHT levels, that sort of thing. Um, all these modalities that we're using to our advantage, in addition to the hair restoration, because I want to keep as much of your native hair on the top of your head that we can over time. The more native hair you have, the better your results are going to be, the better you're going to look, the less hair loss you're going to experience over time.
Mhm. Sounds good. Okay. I want to touch base on the other procedures you'd mentioned very quickly because we're coming up on time. Use or mention, I got in the bio, I saw that you had done Chrissy Teigen's eyebrows, which is fantastic. So tell us about the eyebrow surgery or the rejuvenation that you do for women on the eyebrows. How does that work?
So eyebrow hair transplantation, my champagne brows procedure, is based on the traditional hair transplantation techniques that I learned way back when, but I've refined it, and I haven't, I didn't create eyebrow transplantation. It existed long before I started doing hair restoration. But the techniques that I witnessed, and learned about, were a little too, they weren't refined enough in my mind. So I took those techniques the traditional hair restoration techniques, and really refined it into a specific procedure where I'm creating an eyebrow. I believe that my artistic touch, my creativity is what gives me the results that I can achieve, and have patients like Chrissy trust me to
Mhm.
transplant eyebrow hair, hair into their eyebrows and have it look natural, because they're on camera, it has to look as natural as we can possibly get it. And I've seen some really unnatural results. And if you go online or you're looking, you can see some of these results. I've seen hair where it's growing straight out of the eyebrows, and that's just poor placement. It's
Mm,
just not understanding how the hair has to be placed in order for it to grow and look natural. Now, I do use hair. Donor hair really has to, the best and most reliable hair is still from the head. So, what comes with that? Hair growth. It's going to grow like it's on your head. So when I transplant it into the brows, I tell all of my patients during consultation, know what you're getting yourself into. That means that you're going to have to trim your eyebrows for the rest of your life. They're going to grow for the rest of your life. There's no
yeah.
stopping them at the right length, like eyebrow hairs sort of stop. Now, in the future, maybe we can control that and we can get those hairs to stop growing. But for now, it requires maintenance maybe once or twice a week of trimming the brows to keep them the right length and have them, look natural. Um, it's the same hair transplantation process. Most women, I perform the FUT method, take a little strip of scalp because they have long hair for the most part. Most women don't shave their hair to the scalp. They don't, and when I have that conversation with them, the FUT versus the FUE, most of them still choose the FUT method because it hides. They're not worried about a little linear incision in the back, and their results are better because we can really, I don't have to trim the hair as short, number one, when I'm transplanting it, so we can see a slight curvature in the hair follicle or in the hair that's exiting the skin. That's important too. If you have, and those are, by the way, best candidates, ones who have a slight curvature or a little wave or curl to their hair, because eyebrow hairs naturally have a little curvature. They grow out and then back toward the skin. So
Mm,
those patients who have a little curvature are better candidates than someone who has really straight hair or someone who has really coily hair so that it looks natural. When I'm transplanting those hairs, or making those incisions for the donor, I mean, for the recipient site, I'm making sure they're as shallow as we can. I can get them right under the skin. And then also paying attention to how those hairs are going to flow. We want to create a brow where the hairs grow sort of upward in the beginning or in the middle of the brow and then flow naturally toward the side. Starting from scratch with no hair available in the brows to go off of is the hardest. And that's where you really have to know what you're doing to create that natural shape because you don't have a pattern to follow. You don't have a natural hair pattern to follow. So you just a lot of experience. And I study eyebrows all the time. I'm looking at different types of eyebrows and looking at shapes, looking at how the hair grows and trying to replicate that when I'm making my incisions. And so that's how I'm able to achieve those natural looking results. Um, but the hair plantation process overall is the same. So recovery wise, you're a little bit of downtime of maybe 5 days before you can touch your brows, touch the hair. After 5 days, those follicles are sealed into the skin and not going anywhere. So you can wash that area. Scabs, little crusts are present for about 10 days after the procedure. And then the hair, which we didn't talk about, scalp and eyebrows, no matter where you're transplanted, majority of those transplanted hairs shed. The root system, the follicle stays below the surface and regrows hair at about 4 months on average after the transplant. And that's the same for scalp and eyebrows. So you do go through a little shedding phase where you lose that hair that we transplanted, and then it grows back permanently starting about 4 months later.
gotcha. This is going to take 4 to 6 or even more time to kind of see the full results of your transplant procedure.
The best
Okay,
results, correct.
got it. The best results. Last question, which is twofold question. Number one is why are women seemingly losing more eyebrow hair than men? What do you think is the root cause of this? And the second one, if you could just briefly touch on, we didn't get time to do this, is who's getting beard transplants and how does that work?
So women are losing eyebrow hair because a majority of them over tweezed or waxed or threaded. Those processes where they're intentionally pulling hairs out of the skin. The more times you pluck or tweeze that hair, remove that hair, you're causing a little bit of trauma to
Mhm.
that follicle. So when you're ripping it out, you're causing some trauma there. And over time, that causes some scar tissue and reduces the blood flow to that follicle, which eventually causes it to die, basically.
Mm,
So it doesn't grow back. A one-time tweeze likely most of that hair will grow back. But over time, the more trauma, the more hair loss. And then you end up with thinner and thinner and smaller brows or patches that are missing. And those are the patients that are coming in and wanting that hair restoration for their brows. Um, for men, it usually happens later in life where we start to thin from the outside in and from the middle towards. So a lot of guys sometimes will end up with just a little patch of brows in the middle. I do hair restoration, champagne brow procedures for both men and women, but the majority are women because most of the time it's women that are over tweezing their brows.
Hmm.
For men, for beards and mustaches, overall best candidates are those guys that are either, have some patches that are missing. They don't have a full beard. Um, Again, because of donor hair and how much hair we can actually transplant to the face and mustache area, we're limited with donor. It may take several procedures to get you to a full thickness beard, because most guys don't want transplants that are just kind of very sparse and thin. They want a full beard in general. And many times that can't be done in one session.
Mm.
And so it may take 2, even 3 sessions to transplant hair into the beard. And then keep in mind, those patients who are transplanting hair to their face, in my mind, should really have no history of hair loss.
Right.
Because if we're borrowing all that hair from their head to put in their face,
Yeah.
you don't really want them to have to, in the future, want a transplantation for their scalp. And now you're like, oh, well, we used it all for your face. So,
Yeah.
again, it's individualized. I'm looking at your specific history, where you're headed. Some guys I'll say, look, maybe we need to think about preserving that donor hair for your scalp and not use it in your face. You
Yeah.
can shave and still get away with that. But if you go bald on top, that's something we have to consider. So
Hmm.
that's all important. Um, Guys who really don't have much facial hair, not as good of a candidate unless we say, look, I can only really give you a smaller little strip of facial hair here, not a full beard, just
Hmm.
because of amount of donor hair available, and number of procedures it would take to get to that
Got it.
result.
Got it. Got it. Okay. I guess one small mini question is that let's say a guy has everything stacked against him. He's a young man, he's aggressively losing hair, got a family history, all of that's going against him. Is he, with the procedures and techniques and technology, medicine available to us today, can he stop the hair loss, halt it so that he can keep what he has for the next 30 years? Or is he definitely destined to lose it all?
The sooner we can get a jump on the hair loss, the better. So I would say I'm talking to patients out there right now. If you're starting to see some hair loss and you're young, you're 18, 19 years old, don't think about hair transplantation at this point. Think about being preventative. Don't get in your mind that you're going to do surgery to fix the problem, because that doesn't fix it. It replaces hair that's fallen out. It doesn't stop hair loss. So the root cause of your hair loss needs to be addressed. At the moment, we can put a pause on your hair loss, sort of a pause. We're really prolonging your hair loss over time so that it's not as rapid. And in those guys who are really young and losing hair rapidly, to me, you really need to consider doing all of the different types of treatments available to us that we already discussed. I would also say younger guys, when it comes to finasteride, there are some side effects to be aware of, including erectile dysfunction, including loss of libido or reduced libido. Your sex drive is not as good. Um, those are things to consider. It's also important when it comes to childbearing years and those sorts of things with your partner. You have to be careful with topical serums that could potentially come in contact with skin of your partner if she's pregnant, for example. Those are all the conversations I
Mhm.
have to have with younger guys, right?
Yeah.
Um, and then considering the risks of side effects. Most of the time, if you stop that medication, if it is causing those side effects, those issues go away, and you're back to full function. However, in literature, I've not seen this in my own patients, but in the literature, it does exist where sometimes erectile dysfunction doesn't go away after you stop the finasteride.
Right.
And that's also something that can be scary to a lot of younger guys, especially. And like, ugh, I really don't want that to happen. So it's all part of the conversation that I have to have in an individualized basis. And you take that information and you have to make a decision for yourself as to what would be best for you. But I would say, really trying to attack your hair loss from with all the different options that we have is the best way of being preventative over time, knowing that we can't honestly fully stop it. At some point, you're going to notice some thinning,
Mhm.
but at least halting it, slowing it down, being able to maybe approach it with hair transplantation to kind of fill in those areas that are starting to thin, but continuing to be on that preventative course is the best route for you, versus letting it all fall out. Now, you can, obviously, if you're okay with going bald and doesn't bother you that much, but some patients, don't want to be on that path. And I would say that's something to just keep in mind that at the moment we can't completely stop your hair loss, but we can really slow down that progression and spread it out over many, 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 many years.
Mhm.
That's the best I can offer.
Got it. Dr. Champagne, thank you so much. You've been very graceful with a lot of robust questions that I asked you. And I think for people listening to this podcast, they'll get a lot of insights into what are the options, especially exosomes and how good they're performing. And then also transplant as an option for them. And that having a discussion with the provider is very, very important before you say, I've made up my mind, this is what I want to do, and going into it. Because there's many things you have to discuss before you jump in and spend that money. So thank you so much for coming on. Where can people find you online?
Online, it's uh, jasonchampagnemd.com is my website. It's at Dr. Jason Champagne or Dr. Jason Champagne for Instagram, Facebook, those sorts of things. So yeah, we're online. Find us. I'm here in Beverly Hills, and it's been my pleasure to chat with you.
Likewise, if you're in LA or around, definitely go visit Dr. Champagne. And if you're considering having this discussion after you listen to this interview, reach out to him regardless. Thank you, Dr. Champagne.
Absolutely, my pleasure.